So for young individuals who have an intracardiac defibrillator, the first point to make is that they have been considered at significant risk of having an arrhythmia that can predispose them to sudden cardiac death. So if you take a pyramid of the conditions we're discussing about, they will be at the top of that pyramid. And as a result, it's important that we're very cautious as to the advice that we give them for their lifestyle as well as the exercise that they are able to do. Every condition is very individual, and it's important to recognize that, and it's also important to recognize that we know more for some conditions compared to some others, because that will give us the ability to recognize our limitations regarding advice in general and exercise prescription. If we take, for example, individuals with Brugada syndrome who have an intracardiac defibrillator, Brugada syndrome is one of those conditions that is not particularly associated with exercise. So the sudden deaths usually happen at rest when individuals are not exercising, and the common scenario is someone will go to sleep and unfortunately never wake up. So as far as Brugada syndrome is concerned, we can be fairly liberal with the amount of exercise they are able to do. However, even with Brugada syndrome, it's important that we highlight to them certain things that they should be aware of. And number one that we have to say to all our patients anyway is that they should be avoiding any illicit substances. And it's not just illicit substances that are important, but also all the high performance drinks that are around in the market. So some of them may have an abnormally high amount of electrolytes or abnormally high amount of caffeine that they may impact on the way that your heart works, particularly if you've got an underlying condition such as Brugada syndrome. The other important point to make is that yes, you can compete and perhaps you could be also do a marathon, but the important thing is at what intensity do you do that marathon, and also to look after yourself when you do that sort of exercise. So the important message will be that they need to keep well hydrated so they don't create electrolyte abnormalities in their blood, which within the context of that condition will make them more prone to fatal arrhythmias. And the other important thing is that they avoid events that happen during high temperatures, during summertime, of prolonged duration, that they're more likely to raise the temperature of their body, because there have been fairly solid associations between individuals with Brugada syndrome and increased temperature developing those fatal arrhythmias that can result eventually to sudden cardiac death. Regarding alternative conditions such as long QT syndrome or another condition called CPVT, there needs to be a bit more caution, because we know that particular forms of those conditions are more closely associated or more strongly associated with exertion or particularly emotional stress. So for example, CPVT predominantly causes sudden cardiac death in individuals who exercise, and it usually does happen during exercise. So there we definitely need to restrict competitive sport, and we need to be very cautious when we prescribe a moderate degree of exercise, which should usually happen within the context of a hospital setting in order to test those individuals, see how they behave when you put them on a treadmill test. And then the other potential restriction will be to avoid the very intense start-stop sports, which my personal feeling that individual is less likely to control how much effort or how much burst they put into their exercise compared to someone who is fairly continuous, such as jogging, running, swimming or cycling.